same thing again. We're going to do radiology. There's more than just a CT and x-ray you can do for the head and neck. The abdomen has a lot of stuff you can do. So we're going to just see a few things. Everything that I'm showing you is something he told me to show you. So, alright, so this is the abdominal radiology. The first thing we're going to talk about is a KUB. It stands for kidney, ureter, bladder. It's a x-ray that runs from the kidneys to the bladder. So that's why you're only seeing some stuff. Again, don't forget the organ tissue you're not going to be able to see on an x-ray. You guys are making me really nervous all recording me.
Doesn't even make sense for all of us to record her.
So, yeah, so you're not going to see organs unless, for instance, right here, this organ happens to be filled with a lot of air, so you can see it. Does anyone know what it is?
Ascending colon?
Yes, ascending colon. You can see the little haustra, all that. You can also see a little bit of the transverse colon, a little bit of the descending, and anyone know what this is?
Gastric bubble?
Yes. Left colic flexure or the splenic flexure. So that's pretty much all you can see for organs. You can see the lumbar vertebrae, you can see the bodies, the transverse processes, the spinous processes here. Don't forget you can see this is a spinous process, so if you labeled that, that's fair game. You can see bones of the pelvis as well. You got the sacrum down here, the coccyx down here, pubic symphysis right here. Anyone know what these are?
Rami.
Which one?
That's the pecten.
Which rami? Superior. Yep, the superior pubic rami. Can't see the inferior, they got cut off, but you can see this right here. And this right here. Obturator foramen, yes. You can see this area right here. Anyone know what that's called? Yes, the acetabulum. We're not going to talk about the leg because you'll do that in the lower extremities. But here you have, what's this? Iliac crest, yes. What's that? ASIS. And over here? PSIS. What about this guy right here? And right here. Yes, you're the only one that's gotten it today.
Yay!
Awesome. Yes, that is the sacroiliac joint, and you know how much he loves those on tests. So, just saying. Stacy, did I forget anything? I don't think so. Okay. So the next thing we're going to talk about is an IVP. This test is not really used anymore because now we have CT scans that are better, but because you can see some cool anatomy stuff on here, he wants me to show you. And the reason that you're seeing some organ tissue on this x-ray is because this patient has been injected with some dye. So it's showing up on x-ray. So right here, you have a great picture of this structure, which is what?
Kidney.
Yes, you can see this right here. This one's the minor. This one's the major. You were close though.
Oh, so not all three are major.
No.
Oh, really?
The lower one's the minor, and then this big one's the major.
Oh, now we know.
Then you got this structure right here.
Renal
Renal pelvis, yes. And then this right here.
Ureter.
Yep, and you got the same thing on the other side.
Ureter.
And this
Urinary bladder.
is the bladder, yes.
Beautiful.
They used to use it to diagnose stones, but now it's just easier to see on CT. Plus, you don't have to give the patient dye. Don't forget, you can still see parts of the pelvis, so if you were to use an image like this, you know, all this is fair game. And same thing with the lumbar. And you can see some air in the colon here, but not that well, so don't worry about that too much.
What does IVP stand for?
Intravenous pyelogram. Any other questions?
What was KUB again?
KUB is kidney, ureter, bladder. It's just a plain x-ray. This one has dye. So,
Do we have to be able to differentiate which one is which? Like,
I don't think so, not for the
Okay.
test.
okay.
For radiology.
I mean, for radiology, definitely.
Alright, we'll worry about that. Okay. Sorry.
Okay. This is a barium swallow. I apologize, the image is not that great. When I blew it up, it got a little blurry. But there's really only one structure you can see, and it's this one right here. Does anyone know what this is?
Esophagus.
Yes, it is the esophagus. So in a barium swallow, the patient's going to drink barium. It's gross. They're going to drink barium, and it's going to line the esophagus, and then you take an x-ray, you can see it. Things like that, these are just different views of the same thing, so don't worry too much about that. But you can only see the esophagus in this picture. And if there's something abnormal going on with the esophagus, you'd be able to see it. If there were a polyp or cancer, whatever's going on, you would be able to see it. So that's barium swallow. Any questions about that?
This one's completely, totally normal.
This one's normal, as far as I can tell. I mean, it's a little blurry, but I think it's normal. My radiological expertise would say it was normal. Okay.
Different colors.
Now, that's just, so that's a good point. So, the reason why you're not seeing as much white here is because in this image, the barium has already moved on. Because the patient's swallowing it, so it's going to work its way through the GI tract. Okay? So that's why you're not seeing it as well. And that's normal.
Okay.
Alright, so this is an upper GI. So basically the barium just continued from the esophagus to move to other parts of the abdomen. Can everyone see? Okay, so unfortunately this picture's labeled, but it's a really good picture, so I used it anyway. But you have the esophagus here, and then what's this structure? Yes, it's the stomach. And here, yep, it's labeled, so
It looks weird though.
pylorus, yes. It does look weird, and
Why
the
is it
reason
like
it looks
that?
weird is because this patient's stomach is contracting, and that's why the muscles are making the stomach look smaller, because they're contracting the stomach. This right here, the reason it's white, some of your classmates were asking me, is basically the dye has just pooled there. You need to give it some more time to move on. So this patients that do this get exposed to a lot of radiology because they just keep taking pictures to see where the dye is, so it's not fun. And then here you can see this structure, which is what?
Duodenum.
The duodenum, yeah. This is a full stomach, or not full, but a non-contracted stomach, so you can kind of see the whole thing a little bit better. And you could see the rugae really well in this picture. So I thought it was cool to show you guys.
Does the barium get up to the fundus? I thought that it always stays.
Well, you move the patient around to try to, the patient's lying down, you move them around, like you'll see them doing like this a lot, like you move them around to try to get, yeah, they'll lay on their side, just try to get the dye to
So
cover
weird.
everything.
Okay. That makes more sense.
It's not fun for the patients. Okay, so this is a lower GI, and if they just have to image the lower GI, they'll do it through an enema instead of through a barium swallow, which is equally as not fun. So here you can kind of see a little bit of the stomach going to the duodenum. I don't know if you guys can see that. And then this jumbled mess right here is what?
Jam in the ileum.
Small intestines, yes. This patient is full of feces, and that's what you're seeing.
Yeah.
All those thumbprint signs. It happens a lot. Patients come into the ER with abdominal pain. Most of the time they're constipated, so.
Especially in the elderly.
Oh, yeah. Yeah.
Drug users. narcotics.
I had a med student think she had appendicitis, and she was just constipated. So, and then this right here is the ascending colon, the transverse, and then you really can't see the descending that well. And then this is just another image of just the colon. So you can see here the ascending colon right here is what?
Right colic flexure.
Yep, right colic flexure. And this is the transverse colon.
Yeah, left colic flexure.
Or splenic, yep. And then this is the descending colon, the sigmoid colon, and the rectum. This,
Sorry, how come on the picture on the left, so the barium still gets all the way through there, even though they're constipated?
it takes a long time though. It's not fun. Really, really not fun. But yes, they will travel.
Are the color differences the same thing? They're just moving them funny because there's like a spot of really
Yeah,
black
that
there?
just means that this dye got pooled here, and then it continued, but then this part moved on. The dye does funny stuff
So
like
it's
that.
not just that it's dead or something.
No. No. You can still see the outline of the colon, so. Something that's not probably going to be on your exam, but is really cool to see, is this right here.
Yeah, what happened there?
This is called an apple core lesion. Can everyone see how it kind of looks like an apple core that someone bit out of?
Yeah.
Or ate, I guess would be the better word. So that is called an apple core lesion, and it signifies colon cancer. So if you see that, that's like an automatic colon cancer until proven otherwise. So it's pathology. It won't be on your test, but it's just a really